Hi guys, I'm Himani. I'm a lifestyle and wellness influencer. The other day I got a knee injury and I was bedridden for 2 days. And it was a bad depression I was in. While I was at the hospital reception, I met Neha and I was amazed by looking at her right and positive attitude. Neha is a breast cancer survivor, and today I'm hosting this very special interview with her. And along with her, we have Dr. Bhuvan Chug, who is a medical oncologist at Mark's Hospital, Gurgaon. He has been the pillar of the breast cancer survivors here, and I would like to ask him a few questions today. So, doctor, can you tell us a little about the breast cancer in our younger generation these days?
Breast cancer in younger generation is a growing rapid pace. I should tell you, other day we were sitting in a tumor board and we were surprised. Out of the 24 odd cases we had that day, almost 18 to 19 were less than 45. And we actually asked our coordinator, have you put in an age filter or something? So it was such a surprise to see that, the breast cancer in women is happening at such young age, and you feel sad as well as feel worried about it. What is causing that? What is it that is going wrong? Is it that we are picking it up early because we are screening more, or is it the lifestyle which we are living these days has caused the breast cancer to come at such early ages? And not only that, they come in all the stages. Younger women, they come at early stage, they also come at advanced stage, and that's what is worrying. They have their whole life left with them, and then your treatment has to be it has to encompass everything, that they need to remain fertile while they do it. They need to have their careers going along with it. Most of them are new moms who need to take care of the child along with it. They've just gotten married, or they've just stepped into the world of college. So I think breast cancer or any cancer in younger comes with its own set of challenges. I'm not saying that these challenges are not there for the elders, but then yes, there's a separate set of challenges when it comes to younger women with breast cancer, and number is growing.
So, when you talk about that it's coming in younger generation.
So one thing I would like to say is, just don't think it cannot be cancer. So the other day I was treating a younger woman, and so it was a fairly advanced cancer which she had, and I asked her, how come it's grown this much? The answer was very honest and very earnest. Like, I didn't think it would be cancer. Like, I'm too young to have a cancer. We are not young, or we are not too old to have anything. So that that girl, possibly when we detected it, it was almost it was a locally advanced breast cancer by then. So any suspicious lump, if it is there, just don't ignore it. Also, the challenge is that mammograms or mammography, which is the most common screening test which you use for breast cancers, is usually advised beyond 40 years of age. So what happens in younger women is that the younger women tend to have denser breasts. So when you have denser breasts, it's difficult to pick up small lumps. It's difficult to investigate those small lumps. You are more in denial. You are living your life. You never think that you'll stumble upon something called as cancer. So it's a mix of factors. Plus, it's the lifestyle which we're living these days. We have late pregnancies. We tend to have, women tend to have a consumption of OCP pills have increased. So I think it's a mixture of many things which eventually lead to this increase in incidence.
How did you figure out that yes, my screening needs to be done, or like the breast cancer screening needs to be done?
For me, the journey was quite shocking. I just delivered my daughter 6 months before, in 2019 September, and I was enjoying my motherhood and living that dream fancy life. And of course there were multiple lumps when I delivered my baby on the very same day in the hospital itself. However, the gynecologist, she told me that these could be milk ducts or gelectocene, जैसे the family says दूध की गांठ हो सकती है. I ignored them, and surprisingly most of the lumps also went away in couple of months, but then there was this one lump which persisted. So I went again to my gynecologist to get it checked again, but she gave me this antibiotic course and she told me that it is most likely a milk duct, and you follow ahead with this course, and yeah, that's it. But at that very same time, if you remember, the COVID hit India. It was at its peak in March and April 2020. So from hospital to hospital I was going, and everyone told me that it could be a gelectocene or a milk duct or something else because you just had your baby. But finally, after getting myself, after getting the biopsy done for the third time, my doctors at Max were very, very, very sure after examining me physically that it is a cancer. So, somewhere deep down inside, I could, feel that the lump was growing from what it could have been a 1 to 1.5 centimeter. It turned out to be 6 centimeter when I was finally diagnosed, or when it was finally written on papers that it's invasive, full blown invasive ductal carcinoma. So, that's how it happened for me. I would, yeah.
So, doctor, do you think that is it a possibility, or it would have been a possibility that in the first biopsy it would have been detected, or if it would have been very, very sure for the first time, it wouldn't have increased? Could something like that happen?
So, Neha's case is a prototypical younger woman case. She just delivered, she had multiple galactoceles, which is normal in a woman. So, this is what I was trying to tell you before. It's like, when you have a younger woman, the breasts are denser, you generally also tend to think that she's too young, she may not have cancer. So, I think, also the breast cancer in younger women tends to behave more aggressively as compared to older women. In a premenopausal, even a hormone positive breast cancer, which is supposed to have an overall good outcome, tends to behave in an aggressive manner. So, yes, it could have been picked up early, but then you also need to understand that she is a case who was already under a medical surveillance. By the time she felt a lump, she had already asked a doctor what it could be, and she never let it go. Despite that, it reached to a level which was always a T3 size in our medical terms. So, what we need to understand is that it can be cancer. Just accept that and get it evaluated, rather than simply saying, or rather than simply believing, or be it being you or be it being your doctor, that no, it is not cancer. So that's where it is, nothing else. And obviously the challenges are there. She was a younger woman. She was a woman who had just delivered a child. She was busy in her life, taking care of a child. COVID is running around. The medical facilities are at the least possible accessible at that time.
Actually, my gynecologist was so much sure of it that it's a milk duct. She did not even for once told me that you could get it screened, or you could get it. You can go for an ultrasound or anything like that. But after I came to Max, then the doctors here actually suggested me that after delivering your baby, it is a mandatory thing that the women are supposed to undergo an ultrasound to make sure that all the lumps, they are milk ducts. And how could you have missed it possibly? I just told them that it happened with me. I mean, it was very abrupt.
Also, doctor, now I have this basic question which I think everybody just hits their mind, that does lifestyle and diet can help decrease the incidence of cancer?
Oh yes. It's been a general misinformation that most of the cancer in young is possibly because of the bad genes. But then if you look at the data which has been there with us, in our language it's called as a hereditary, then which has passed down from one family to the previous generation to your generation. It's called as a hereditary, and it's not more than 5% or 6%. Sadly, Neha is one of those people who had, she had it in her family, but then
I'm a rare species.
she was a rare species. So the thing is, and she is actually a rare species because it doesn't happen in more than 5% of the population. Majority of the cancer is sporadic. It tends to develop in you as a first case in the family. And, obviously there are factors at play. There are multiple factors at play. And yes, a good number of them are unknown. We do not know why this happens, but a good number of them are known also. So, for example, in a younger woman, the possible reason the breast cancer is increasing is because of the morbid obesity. People, generally, it's been seen that the incidence of breast cancer is more in a obese woman. Especially if you had a breast cancer and then you've gotten treated after that and you've not lost weight, there's a chance of recurrence also high. The other is alcohol consumption, smoking consumption, the late childbirth, the first childbirth which is being late. So, consumption of the oral contraceptive pills. These are the modifiable risk factors. There are certain non-modifiable risk factors such as early onset of periods or menarche, that's called as, so which you can't modify. You have your periods when you have your periods. So, but then, yes, having early periods also puts you at a higher risk of having younger breast cancer. So that's about the breast cancer. And similarly, there are risk factors for younger onset colorectal cancers. You won't believe it. The number of increase in the younger onset colorectal cancers has been very significant these days. And in general, as I told you before, a younger onset colorectal cancer also has poor prognosis as compared to possibly a 60 years old or something. So for that, obviously there are certain diets. We have been consuming a lot of processed foods. We have been, the diet which is, and also you'll be surprised to know that there's a lot of urban clustering of younger cancers. It's not by chance, or it's not just by you stay near in the cities and then you get checked up sooner. It's not because of that. There's an urban clustering of it, possibly because obviously of the lifestyle. You don't have a similar number of younger onset cancers in villages or the rural India. It's more in the urban India. So I obviously understand and obviously think that there are certain risk factors which have still not understood properly, but they are there. As I told you, the diet has a strong role to play in that. The consumption of the foods which are processed, which has carcinogenic materials in it, it's also there. We have not identified them as yet, but then sooner or later we will.
How difficult was it to handle it all in one go?
So I remember I cried for first 15-20 minutes, cried my heart out in that, this is the moment wherein I have to step up for my life and for myself. I did not had the option to give up.
So inspiring, because the other day I was the Aisha Chaudhary, from the Sky is Pink one. She was like 8 years old, and I was just watching the movie, and in her TEDx talk, that was the same thing. It's the attitude, whether it's an 8-year-old or a 32-year-old. I think it is the attitude which actually speaks, because I think your emotional, balance is very, very important rather than a physical. You'll only be able to manage it once be able to manage your physical thing once you're emotionally very, very sound and you're okay to take it ahead. And how about the family that you've talked about yourself, and how did the family reacted, and how has been the journey? Because I think it's equally hard for the family as well.
Obviously, my family was very worried because I lost my father to cancer in 2018. So my mother was very devastated. She started crying.
A year after?
Yeah, I lost my father to cancer in September 2018.
And then you got detected in 2020. Okay.
Yeah. So I got diagnosed in 2020. So of course in my family the cancer was related to death sentence, because I have lost my bhua also to cancer, same breast cancer.
You have been essentially a very human about it. So, what I think is, going back to that survivors meet which we had, and I think you have been the strongest woman I had possibly seen. And so I have seen your weakest moments also. I have seen you giving me a call in the middle of the day. And so I was on a Mongolia trip, and I was doing a OPD in the Mongolia, and she gives me, and I have to excuse everybody, like, chhod do, mujhe Neha se baat karni hai. She is panicking. I need to stop her from panicking, but that's how she is. She is human about it. She'll cry, but then the way she faces something, it's an amazing spirit which you have to see.
So doctor, now I want to move it to very, very specific, that what are the specific symptoms and how can we actually know that yes, now is the time for screening? Because in this I would really want very, very specific to the point, because I want to actually get that message across that these are the symptoms, this is the time you should just hit your screening and just move.
So I think there are 2-3 points where I would like to make right now. Anything can be cancer, provided that the sweet spot which we generally want to define is 3 weeks. So if there's been a symptom in you which is more than 3 weeks, think cancer. If there's a lump, it has been persistent for 3 weeks, think it can be cancer. If there's an oral ulcer in your mouth or in your tongue and it has been more than 3 weeks or 4 weeks, think cancer. If there is a rectal bleed on you when you're passing stools and there's a bleeding which is happening, and it has been happening for more than 3-4 weeks now, think cancer. So when you talk about symptoms, it obviously depends upon which organ we are talking about. It can be a head and neck, it can be breast, it can be lung, it can be tummy, it can be your large intestines, it can be any lump. So depending on which organ we are talking about, depending on which symptom we are talking about, the duration would possibly be a 3 weeks or a 4 weeks at max. And yes, there is no one symptom, because we are talking about essentially 100 different cancers in the body. So you pick up particular organ, for example, as I told you, tongue, oral ulcers, you have right risk factor, you've been a smoker, you have been a tobacco chewer or a betel nut chewer, or irrespective, let's leave these habits aside. If you have an ulcer on your tongue, it is a deep ulcer, it has been there for 3 weeks, please get it checked. You just need a punch biopsy, just need to show it to a clinician. If it fits into the criteria, you will probably get a biopsy done and you'll have a clear answer to it. So what I'm saying is, similarly, if you have a lump which is there in your breast, like for example in her, had it been a galactosele, it probably would have settled. But then, it was persistent. That is the reason she chose to undergo. Similarly, if you have, generally younger people, what they tend to have is they have altered bowel habits. They have loose stools altering with, constipation. If it's been persistent for more than 3 weeks, get it evaluated, show it to a gastroenterologist and see. Suppose you have a breast lump, show it to a general surgeon or show it to an oncologist. If they obviously, there is something called as a triple assessment. For example, in breast, you clinically examine it, you feel, does this look cancerous? The second part of the triple assessment is you get a radiological scan done, be it mammogram or be it ultrasound breast. And then the third part of the triple assessment is biopsy. So you finish this entire thing one by one in a sequence and then arrive at a particular thing, whether it is cancer or not. Similarly, for let's say you have bleeding per rectum or you have blood in your stools, show it to a gastroenterologist, let him examine, let him put a finger up your ass, as in, you do a per rectal examination. We generally tend to miss these rectal cancers because nobody chose to do a per rectal examination. So let them do a per rectal examination, let them figure out if they need be, let them put in a scope there and see if there is something which needs to be understood. So what I'm trying to essentially say is, for each particular symptom, there is a way to examine and evaluate. Just follow that in a methodological way, that's all.
You also, in the beginning talked about that, there are so many percentage of people who have this, breast cancer. Can we get into this a little solution mode that, there's once, it's been detected, it does have survival chances also.
The problem, what we've had with the Indian population is that most of our cancers tend to present in an advanced stage. Rather with, people like Neha and then, I think as they're evolving, the screening for the breast cancer is increased. We tend to have cancers at an early stage now, and rather it's only 10 to 12% of patients which are non-curable. Rest majority of the cancers are curable. Almost up to 85 to 88% cancers are curable. And you just need to have faith in yourself, your treating team, and follow the process. You will eventually be out of this phase. It's 100% curable in majority of the people.
Yes, I think that is the positive note I wanted to end the conversation with you, and because now I'll move over to Neha, the star. So, in terms of, can you tell Neha that, did you saw any changes in yourself before and after, like your treatment?
Of course, I think I became much more confident as a person. I started living in the moment right now rather than in some near future. Earlier, I used to plan my life that probably after this many couple of years, I'll start doing this. But now I've started living in the present. Now, this is the moment for me. And I have let go of all the expectations from anyone except from myself. So, from my doctor. So we tend to follow life in a particular algorithm, like, by 18, let's get into a college. We are here to live and not follow any guidelines. We have this expectation that, my life is supposed to go in this particular direction, or I'm supposed to live this which way. But cancer made me realize that, if I could be diagnosed with cancer at an early stage at 32, so life is not meant to live by particular guidelines or by following a particular algorithm. So, whatever it is, I have live in the now. That's it.
I think this has been a great conversation, because it's been one of an experience for me. I'm really saying this by the heart, because you get to experience this side of the world when you're so busy in your corporate life, and but then you get this side of things that yes, there is hope, there is positive attitude and the right attitude everywhere where you need to go ahead with. And also, Neha, I'd like to, just if you have to sum up this interview, then can you give a take-home message for all of us who are watching?
What I have realized is that we as women, we don't, make ourselves a priority. We take care of everything in our life, our husbands, our kids, our families, our siblings, our friends. Everything is a priority. Our job is a priority, but our health is least of a priority. Do not make this mistake, ladies. I think a happy woman can only create a happy home and a happy family. Get yourself checked up. Eat that food which you cook for your family. We cook for a family, but we forget to eat it ourselves. No. Eat that food, eat that particular fruit. We will give 5 different varieties of fruits and vegetables to our kids and our families, but we won't eat it because we have a lot of other chores to do, the laundry, the household chores, the baby. But do we actually take care of ourselves? So the one thing which I would like to tell everyone, which I tell every woman out there in my life, is that make yourself a priority, because when you will have a good health, a good physical health will lead to a happy mind, and a happy mind will lead to a happy family. So it all begins from you.
I totally agree, because what we tend to do is we don't take help. We think that we will do everything, we'll manage it all. You go ahead and you can take help, because I think in this metropolitan, in this younger generation, everybody is there to take like our husbands. And
You won't believe, before cancer, I was just thriving on black coffee, 7 to 8 black coffees in a day. I was cooking food for my family, my kid, everyone. I was giving them 5 different varieties of fruits and vegetables, but I myself, because of an n number of things which were there on my plate, that career woman, that super mommy, and a good wifey, and a good friend, a best friend, I was just thriving and surviving on black coffees. I realized it that who had stopped me from eating the very same thing I was cooking for my family? My own self, right? I could have very well sit down for 15 minutes and eat a healthy meal.
I totally agree, and I can't agree more, because this is what we all tend to do. I've also forgotten my lunch today, but because it was my son's first day to school after summer vacation, so I had made all the preps for him, but not even taken one thing before coming here. Because I was starving. I had something to eat, because I had to continue with the interview, because when it was on my head. So I totally agree, and I couldn't agree more. And she is the person to tell you guys today. And one take home message is that you are the priority, because if you will take care of yourself, is when you will be able to take care of everybody else around you.
And also, I think we as women should need to learn that we are not the prime ministers of this country. Like, the entire family members are, parents, and, our husbands, they delegate their responsibilities to us. We should learn to delegate our responsibilities to them. Like, I was coming for this interview. I told my husband, you better come home and take care of a child, because I have to go for my interview. So, this interview is my priority. Yeah. So, I am now totally free. Whatever is happening, even if he has to change the diaper or feed my baby, that is his responsibility now. Not my circus, not my monkeys.
That's so nice. It was a great time with you, Neha. I would love to meet you post this and have a cup of coffee and play with your child as well. And you just be tension free and we'll take care of it. Thank you so much, Dr.
You're
Bhuvan.
most
I
welcome.
think we had a great time here, and we all should be again get this take home message. I think that was the same, that lifestyle and diet is very important, and so are you guys. So thank you so much for watching it. We all are surviving, and we all will live up to it. Thank you so much for watching.